Hello, viewers. This is Sex in the Temple, and we are back. Season 2 is hot, it's boiling. I'm telling you, you will love it. Thank you for tuning in. Thank you for subscribing. Thank you for sharing and viewing. Continue to subscribe so we can give you more of this. Thank you so much to our sponsors. And Professor Patrick Amwateng is still here. I have to say, during the introduction, I said three daughters. It's four gorgeous princesses. Prof, we continue again. You're welcome to the session, and we continue with male sexual dysfunction.
Okay. Yeah, so from what we had in the first part, I mentioned that the male sexual dysfunction encompasses a series of conditions. And so it's not just one specific condition that affects the male's ability to have sexual satisfaction and also have a satisfied performance. So usually the it may be either with the erection itself, and so we have a whole condition called erectile dysfunction, and then also we have challenges. Some of them have challenges with ejaculation, which is the process of achieving orgasm, and that is also another area. And these are the two broad areas that we would consider when you are looking at male sexual dysfunctions. So we would probably tackle these two.
Please do.
Look at what they are, and then how they come about, what needs to be done when a person has that, and then the treatment options that are available. Um, because we are not permitted to mention drugs and certain processes, I would just explain what can be done.
Yes, please.
And then the people who need more can consult a physician for proper diagnosis and treatment.
All right.
So we just give overview of the treatment for the hearers to appreciate what they need to do.
Okay.
All right. So with the erectile dysfunction, it generally has to do with a consistent or persistent inability to achieve and maintain erection for satisfactory sexual experience.
Okay.
So it basically has to do with the erection. So it must be, the penis must be erected, and it must be rigid enough, and the person should be able to use that during a sexual process. So an inability to achieve this, is what we describe as erectile dysfunction. And this is a major condition that usually, as I mentioned, age is a factor. So within 40 to 50, 70 years, you would have males experiencing, and I gave a range of about 52%. This also reflects the same as erectile dysfunction. So they're unable to have erection enough to be able to penetrate and have sexual relations with their partners. So that is erectile dysfunction. And the key underlying, so it is very important to understand why the person is unable to do that. Remember, I mentioned that there are psychological, um, factors that would affect male sexual functioning, and then the physical. So you could also have somebody who has that, a psychological condition, maybe a condition that would prevent him to even start the whole process of being aroused for sex. So some people would have that tendency, and then that would lead to the dysfunction. Of course, they can't even have the desire, and then the process, and then also not be able to achieve an erection. So usually behind this particular presentation, you will find diseases that are predominant or that will cause that to happen. And the major one is cardiovascular disease, hypertension, and then diabetes.
Wow.
Yeah. So if a person is unable to have erection, then it could be some of these things may be the cause. And usually you find these diseases also occurring in the maybe especially for hypertension occurs within 30, 40 years of age. So if someone has this particular condition and doesn't treat it, it can lead to an erectile dysfunction.
All right.
Yeah.
That's deep. So
Then
yeah.
and then the other one
Mm-hmm.
is with the orgasm or ejaculation.
Mm-hmm.
This is also a very prominent one. In definition, it is consistent or persistent
Mm-hmm.
um, inability to, um, hold before the person ejaculates, which is the final stage of enjoying of sexual pleasure in a man,
Mm-hmm.
within a space of less than 1 minute.
He, so if they have this dysfunction, they cannot hold
So,
it.
so once the person has an erection
Mm-hmm.
and uh, penetrates a
Mm-hmm.
woman,
Mm-hmm.
within less than 1 minute,
They
the
have
person,
ejaculated.
yes, has ejaculation.
Mm.
So that is basically what we call the um, premature ejaculation.
So it has to be consistent, not only one off. If it's like
Yes.
every time,
So
every
it
time.
should be consistent. Yes,
Mm.
it should happen in about 75% of the time within a period of 6 months. The person has sexual intercourse
Mm-hmm.
that this particular problem arises. So they have mild ones,
Mm-hmm.
maybe um, that there are some that can last for 30 seconds. You know, there are some that could go within a minute. So on the average, if you
Mm-hmm.
look at all the average time that a man should, initiate sex and then penetrate a woman and then ejaculate, the average time has always been around 5.4 minutes.
Okay.
But of course, some people could go
Mm-hmm.
higher, maybe 30 minutes,
Mm-hmm.
40 minutes, and they all come with their own associated issues. But generally, for the average,
Fine.
between from 5 to 5.4 minutes.
Mm-hmm.
Yeah. But if the person is unable to achieve this and has it within less than 1 minute, then that is a premature
Premature
ejaculation.
ejaculation.
So that is an ejaculatory disorder.
Okay.
Then there are others who would have it delayed. So they can have it for a long period of time. You know, that is also, most men will want that,
Mm-hmm.
but that could also be a challenge. I mean, that could also be a condition. And then there are those that will not have it at all.
They will not have ejaculation at
At all.
all, but they will be sexually aroused.
Yes.
They're able to maintain their arousal,
Yes.
but they never ejaculate.
Yes.
Wow.
So these are all part of what we call the ejaculatory disorder.
Okay.
Yes. So I'm sure those who have the challenge may want to
Mm-hmm.
prefer
Mm-hmm.
it delayed
It delayed,
or
and
not at
then
all.
and then comes done. You
Yes.
just don't have it at all.
Yes. Yes.
Yes. Okay.
Yes. And behind this, you will
Mm-hmm.
also find some conditions that can present this.
All right.
So the process of ejaculation is still would still involve. I mean, the major concern here, or most of the what is behind the problem,
Mm-hmm.
generally will be people who have psychological conditions
Mm-hmm.
like depression, anxiety,
Mm-hmm.
stress-related conditions
Mm-hmm.
can have this particular ejaculatory disorders.
Mm-hmm.
Yes. So um, yeah, so you have these occurring, and it is a very common thing in most men, especially those who have aged from 40. In fact, it is usually the number of minutes the
Mm-hmm.
man would spend decreases with increasing age.
Okay.
So the younger usually have very longer periods before they ejaculate, and then the older ones, as it goes along, it becomes shorter.
So I know we'll have a session on that. I just want to throw this in. Because of the age and because of the limited time that they don't
Hmm.
stay long, does it then sometimes people get to use the aid of aphrodisiac just to help them?
Yes, yes. So the since you want us to, we will talk about
Yeah,
aphrodisiacs
as a special one.
as
I'm
a
just
special
throwing
one.
this in
Yes,
because you say in age.
yeah.
Yeah, yeah.
But generally, aphrodisiacs would have to help them to first of all like have the desire,
Okay.
and then also it's supposed to um, had or make the erection
Last longer.
last longer.
Okay.
So solving erectile dysfunction,
Okay.
and then also prolonging the time before
Ejaculation.
ejaculation
Okay.
occurs, and then that is also solving an ejaculatory problem.
So, is there treatment? Like, you just
Yes,
talk. We don't name the drugs, of course. We
yes,
are not
yes. So
going there.
there are treatment for both conditions.
Okay.
There are also lifestyle changes, and then there are also assessment of conditions, the predisposing conditions that puts the person into that situation.
Okay.
So if someone has erectile dysfunction, for example, you need to understand what the person, what is causing this particular condition.
Okay.
So it could be hypertension, as I mentioned, it could be diabetes. So once that is treated and managed, the person should be able to have,
Normal.
yes, should be able to resume the normal,
Okay.
level that he or she, so he has.
Okay.
Yes. And then also, if it has to do with the ejaculatory disorder, if the person has depression or anxiety, that must be solved.
Okay.
Even for most of those people, the antidepressant drugs could also help them even to prolong
Okay.
the 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 ejaculation. So
Okay.
that um, would so you'll be solving one problem, you'll be solving two problems with one
Okay. Okay.
drug.
Okay.
Yes. So with the erectile dysfunction, the main issue is with the erection. So we need to give agents that will be able to help blood flow to
In your
the
area.
penis, and then also we also need to more or less like give that would be able to enhance the blood vessels dilating. So there's an enzyme that would reduce these agents that will cause dilation. And so we have drugs that inhibit this particular enzyme.
Okay.
And when you have those drugs, then you can get the erection being prolonged.
Prolong.
So
Okay.
one of them, I mean, it's a common drug that I'm sure people will know. So if I mention it, it wouldn't be a problem. Like Viagra, which is the trade name, that drug inhibits an enzyme
Okay.
in the penile area and then allows a lot
The
of
blood
blood to
flow.
flow so that
Okay.
the erection can be attained. Some of the drugs needs to be injected. So there are
Okay.
some people who would have injections
Into the
injected into in
penile
the penile
area.
area. Yes, into the
So
penis
that.
actually.
Oh, okay.
Yes, and then we also have uh, pumps,
Okay.
penile pumps
Okay.
that are used so that they can.
Externally use
Yes,
it.
externally. Yes, so
Okay.
it's pumped to help
To help put the
allow
blood,
blood to
allow
flow.
blood to flow.
So the whole purpose is to
Allow
allow blood
blood to
and get
flow.
blood to flow
Okay.
in that area.
Okay.
So the person would have enough blood
And
there
then
for
you have.
the erection to occur.
Are they readily available, or do you have
Yes,
to be
they are.
assessed and then they prescribe them?
Well, they are available. I don't know whether they are in Ghana, but
Okay.
some of the drugs, especially the ones that can be, so we have the oral ones, the ones that are normally swallowed. Those are the
They should
tablets.
be prescribed though.
Yes,
You
they
don't
should be
just go and
prescribed.
buy them.
Yes,
Yeah. Okay.
and then we have the ones that can be injected. I mentioned some ones that you would have to inject.
Inject.
So it's usually those who it's quite inconvenient injecting a drug
Is it
into the
all the
penis.
time that they want to have a, or
Yes, so when they want to, yeah.
okay, so they are
But
taught to
you
inject
know,
themselves or what?
yes, so I mentioned that there are patients who have some conditions
Yes, please.
that, so for example, if the person is diabetic and is already using most
Okay.
of the one anti-diabetic drug, it has to be injected, which is insulin.
Mm-hmm.
So they will not be, they will not have fear for
Needles
the
anymore.
needles and things like
Okay.
that. So such patients can still,
Use it.
use it, and they may not have problem. But those who
Okay.
have not been using syringes, they
Mm.
may have some sort of like fear
Okay.
using those agents. So, and then also the pumps, as I mentioned. So all of them would help move
Mm.
blood
Does
to
it
the
have to
penile.
combine with lifestyle changes?
Yes, so lifestyle changes is very important. So as I mentioned, smoking,
Mm.
alcohol,
Mm.
illicit use of drugs, marijuana is also one. In fact, they say alcohol increases the desire and takes away.
Yeah, that's what people say.
It increases the desire,
Mm-hmm.
but takes away the
Oh, there. So
the
it
power.
increases the desire, and then you are left flat tire. Boss,
Yeah.
flat
So
tire, flat tire, flat
yeah.
tire.
So yeah. So that is also a problem. Yeah.
Oh,
So the
okay.
person would have to do that, and then diet. Diet
Mm.
is also very important. So the person should have a balanced diet.
Okay.
That can also be helpful, and then exercising is very very important. Um, and people who are obese,
Mm-hmm.
normally those who have obese would have some problems with their hormones as well, and that can also affect
Can be both male or female.
male,
You
female, yes.
understand?
But in this case, we are talking
We are
about
talking
males,
about
yeah.
men, yeah.
So
Mm.
it'll be important to reduce weight and do a lot of exercising so that you
Okay.
can improve your sexual drive. So for erectile dysfunction, it's also important to do that. Yeah.
Your final word,
And
dog.
then, oh, I was going back
No,
to,
you can go
yeah,
ahead
so
and then you end up with the final word.
I
Yeah.
was going to the ejaculatory
Yeah, the ejaculatory. Go ahead. Go
disorders.
ahead. Yeah.
So for that one,
Mm.
um, you need to be able to reduce the 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 pleasure during the sexual act so that you can prolong it.
The foreplay has to be reduced.
No, not necessarily. I mean the process.
The
So the
okay.
pleasure.
The pleasure. Okay.
Yes. So there are agents that can help reduce the pleasure. So you would not even get to a place where you are climaxing to ejaculate. Yeah.
Okay.
So a drug like we use them to treat depression
Mhm.
can be given to such
Mhm.
patients.
Okay.
And then now they have some delay sprays,
Mhm.
certain sprays. They are generally relaxant agents.
Okay.
They are more like anesthetic agents
Okay.
that are sprayed on
Mhm.
the penis, and that would prolong ejaculation.
So this is with before.
Yes,
Does it not
before.
have an
Some
effect?
have it as spray, some have it as creams that you rub
Okay.
and then you rub off.
Mhm.
Because if you don't, it would also affect the woman.
Yeah, that's what I wanted to
Yeah,
ask.
yeah,
Yeah.
it will also affect the woman. So her place will also be numb. So it's like you are numbing the
Everything.
penis
All
so
right.
that you don't feel,
Okay.
and then for you to get to a stage where you want to ejaculate. So that is also able to prolong the
Do you
ejaculation.
have time span that it can work function? Like say I spray it within an hour, I have to do this within an hour.
Yeah, so usually if you have a time set for
Mm.
the the event,
Mm-hmm.
then probably an hour before, or sometimes it depends on the spray. So they normally indicate on them
1 hour.
like 1 hour
Mm.
or 30 minutes before.
So if
And
there is
then
traffic and red light and green light, you're in trouble then. Red light, green light, red
yes, and
light,
then
green
and
light.
then and then you do it. So yeah, so generally that is how you manage.
Okay.
But that one too, you could also add lifestyle.
Lifestyle
The
changes and stuff.
exercising is also very
Mm.
relevant and important in this.
Yeah, you keep
Yeah,
talking about diet, diet. I think we have to do an episode on how diet helps in this thing. It's all the disruption,
Yes,
everything, a
yes.
lifestyle, but then you put diet.
Okay,
Yeah.
so maybe we can we
Yeah.
can we can look at that.
Mm.
But there's one particular um, fruit
Mm.
which I'm sure men are conversant with.
Mm.
Um, I know of a researcher who is doing a lot on this particular fruit for its role in increasing nitric oxide.
Okay.
So you remember I mentioned nitric
Yeah,
oxide?
yeah, nitric oxide that is
Exactly.
released when it's activated from the brain.
Yes.
Yeah.
That is watermelon.
Watermelon.
Yes.
Ooh.
So
You heard it,
yeah,
watermelon.
so it is a very useful agent. I mean, if you
Including
have
the
a,
seeds.
yes, you could also add the seeds, but
Okay.
generally the watermelon,
Watermelon works. Yeah.
yes. And
So
so
what?
if you want your man to be,
Mm,
you can get a
ladies,
blend,
ladies, ladies, ladies,
a
watermelon,
blend
ladies,
of that
watermelon. Yes.
will be quite helpful.
Yeah.
Yes. And
I had also they talk about ataje.
yes, atadwe is also tiger nut. Yes. So there
Mm,
are
tiger
other
nuts, yeah.
plants that we know about
Mm.
medicines. I'm sure we'll talk about those
Yeah, we
ones
talk about
when
them,
we are
yes.
looking at the aphrodisiacs, because
Aphrodisiacs.
aphrodisiacs will generally involve
Yeah, we involve that.
some
Okay.
concoctions that will
Okay.
involve these plants. Yes.
Okay. Okay.
Yeah.
Wow. Wow.
Yeah.
So, to someone who has suffered in silence, what's your last word for them?
I think for men, usually even though this is a challenge for most men don't talk about it. So there's treatment
Mm-hmm.
for these conditions. You
Mm-hmm.
just have to go to the hospital and report it, and
Mm-hmm.
you'll be managed. But
Mm-hmm.
I mean, as men, we want to keep this to
Secret.
ourselves and
Mm.
then find other means to be able to self help,
Mm.
and then speak with our friends
And
and
they'll
get
suggest
advice
some
from them.
things. Yeah.
It's sometimes it may be the only sign that you are seeing, which would point to an underlying health condition which needs to be resolved. So, for instance, if there's a present high blood pressure,
Mm-hmm.
hypertension that you don't even know about,
Mm.
but you are finding difficulty in the bedroom,
Yeah.
you report that, they
Mm.
investigate further, and perhaps they find that there's high blood pressure, and
Yeah.
that can save you from stroke.
Mm. Yeah.
So I think we should be bold to
To talk
report
about
such
it.
such
Okay.
issues and not
Mm.
just hide behind, and then drinking anything and taking anything.
Yeah.
Yeah.
Yeah. Oh, thank you so much. It's so insightful, Prof. I'm just thinking ahead already. My brain working so fast that we might have a session, just go live and Q&A.
Okay.
What do you think?
That would also be nice. I
Oh,
mean,
thank you
so
so
that people
much.
can, I mean, there will be
People can
questions,
send
or
their
if there are
questions
questions
and
that are
then
in there.
we're
Yeah,
able to get them
exactly.
answered. Yeah.
Exactly.
Thank you so much. I really
You're most
appreciate
welcome.
you, Prof, for taking time out of your busy schedule. I know I really appreciate you. Thank you for coming and looking forward to the discussion with the Q&A and also looking forward to the aphrodisiacs.
Yeah.
Viewers, especially
Mm.
men, this is for you. I know most of the time you don't want to talk about this challenge, but when you talk about it, you'll be assessed, underlying conditions will be ruled out, and whatever it is, there's treatment available. Remember, you have to not only be aroused, attain for satisfactory sexual performance. This is Sex in the Temple, and my name is Monique. Keep watching, keep subscribing.